and treating the person as a whole is the right way to do it. I would say to advocate for parity all the time would be the first step. My personal polemic, my personal belief is that we in the United States have remained an exception to a consortium of developed countries where there is no universal health coverage. Universal health coverage would benefit in many ways because it is cheaper for society as a whole to treat patients with mental illness than not treat them. People with mental illness suffer from very high rates of disability. In fact, I would go to say that mental illness as a group is associated with more disability than any other physical illness. And this has been studied and replicated by many people, including the WHO. Therefore, if people with disabilities are treated and they are able to become productive members of society, society on the whole saves money because they are back in the workforce and so on. There's also a subtle problem with untreated depression, and that is people are not very productive. Their limited productivity causes a serious set of problems for society. Absenteeism at work, for instance, would be a very good example of how depression affects society as a whole. Factories have considered their productivity going down when this has been carefully studied because their workforce may be depressed, or using alcohol, for instance. That's pretty widely recognized. So there are many different ways in which treating mental illness and substance abuse is actually makes economic sense. In states which have enforced parity, and the two states that come to mind are Maryland and North Carolina, there has not been much of an increase in insurance premiums. Insurance premiums have gone up by anywhere between 1% to 3.5% in these states, in the various insurance plans, because they have included family coverage for entire families for mental illness at the same level as physical illness. From the early 1990s, there have been a number of studies that have shown that the rates of mental disorders in the United States is fairly high, but these studies also showed that 2/3 of the people with a diagnosable mental illness do not seek treatment. The reasons for that is multifactorial, obviously. One of the reasons, I believe, is access to mental health care. The other reason is stigma of mental illness itself. Lastly, people are not very well educated or knowledgeable about the treatments. Treatment of depression, for instance, before the advent of Prozac, which was in the mid-1980s, was with antidepressants that caused a lot of side effects, and people were not very comfortable with going on antidepressant medications. But since the end of the late 80s and the 90s, there has been a tremendous growth in the number and a variety of antidepressants with very few side effects that are available. These are extremely safe, and there has been a steady trend of increasing use of these antidepressants, but it is not quite enough yet. Even today, majority of the patients with depression do not seek treatment early, or some of them do not seek treatment at all. Because of the nature of these illnesses as being self-remitting, many of them appear to kind of white-knuckle their way through an entire episode of depression without seeking treatment. But that is the hard way. The easy way would be to seek help, get antidepressant and psychotherapy, and together their recovery can be as short as 1 month. And the quality of life that ensues as a result of this is remarkably different than someone with an untreated episode of depression. The same is true for other mental illnesses. I just use depression as a ubiquitous, common illness that affects about 15% of the population. And so I thought that's important to kind of think about it from the terms of one illness.